Okay, I just want to do one more quick video, this one on congestive heart failure, and talking a little bit about some imbalances in heart rate. So we'll start off with that. So tachycardia, tachy means fast. Tachycardia is an increased heart rate at rest, and it's classified by being over 100 beats per minute at rest. So this will include if you exercise, of course your heart rate's going to go up, but if it's over 100 at rest, it's considered tachycardia. Bradycardia is below 60 beats per minute at rest. Now, this is not necessarily bad. It can be bad if it's caused by some other dysfunctions, right, or maybe a low thyroid or something like that. Then it can be bad, right, because you have a low heart rate caused by a disease process, secondary to a disease process. But if the low heart rate is not secondary to a disease process, let's say it's just because you exercise a lot and you're very fit, you will have a lower resting heart rate. So below 60, bradycardia is still considered bradycardia, but it can be a good thing if it's because it's an adaptation to exercise. Okay, now congestive heart failure is essentially the heart is no longer able to pump to meet the demands of the tissue. So it can't supply enough blood with enough oxygen to meet the demands of the tissue. That's congestive heart failure. And there's four primary things that contribute to congestive heart failure, and they tend to kind of go together, many of these. So one of them is persistent hypertension, which is high blood pressure. So if you have long-term or chronic high blood pressure, this will lead to, be one of the contributing factors to lead to congestive heart failure. A second is atherosclerosis, which is fatty plaques that form within the walls of the arteries that I'll talk more about in future videos. And so that's another contributor to congestive heart failure. So we've got high blood pressure, we've got atherosclerotic plaques. We also have multiple myocardial infarctions. A myocardial infarction is a heart attack. And so when you have a heart attack, some blood has been blocked to a portion of the heart tissue, and that heart tissue dies. Now we'll replace that heart tissue with scar tissue, but the scar tissue is non-contractile. So when you lose pieces of heart tissue, whether it's a massive heart attack and you lose a lot of that contractile tissue, or it's multiple myocardial infarctions and you lose multiple patches of cells on the heart that are contractile, essentially what you're doing is you're losing contractile tissue. So that's going to contribute to congestive heart failure as well. And the last thing is something called dilated cardiomyopathy. And this is so I'm going to think of it as like elastic, like say in your waistband almost gets overstretched, it gets stretched out and no longer snaps back. So this is what happens if we dilate the ventricles, right? So they enlarge. What can happen is it can lose elasticity. So the ventricles will lose elasticity, which means they won't snap back. As I talked about in videos before, the more stretch we have, the more force of contraction we should have. But if we have this dilated cardiomyopathy, that means we've lost some of that elasticity, that ability to snap back, right, and contract. And so, and these kind of go together because you're going to see that happen with chronic high blood pressure, atherosclerotic plaques are going to happen, and other things like heart myocardial infarctions can happen because the high blood pressure could break off a plaque, and that can go to a coronary vessel, blocking blood flow, causing a heart attack, and so that myocardial infarction occurs because of that little plaque that blocked the small artery going to a portion of the heart. So you can see how these kind of work together, and so they eventually can contribute to congestive heart failure. If you have any questions, let me know. Stay strong. I'll see you next time.